Dentists don't want you to know this. Most dental treatments are completely avoidable. That's right, that cavity, that gum disease, that root canal you need, or that implant you need can all be completely avoided. The truth is, your mouth has the power to heal and protect itself. The only thing is, this comes down to one key thing, and that is prevention. The truth is, most people only go to the dentist once something starts hurting. Hey doc, my tooth hurts, what are you gonna do about it? I haven't seen you in like 6 years, where have you been? Avoiding you, duh. But the problem is, once it gets to this point, once something starts hurting, it's a real problem. This is when you're gonna need a big filling or a crown, a possible root canal, or a possible tooth getting taken out. There could be something seriously wrong. The thing is, that problem that happened once that person came in after all those years could have been completely avoided. You see, dental problems start really, really small. You can even see them starting, for example, on an x-ray. Sometimes we have these things called incipient lesions, where it's a cavity that's just starting off. It's very, very tiny, but it hasn't gotten to the point where we need to do a filling or anything yet. In fact, you can actually fix it and completely remineralize that cavity and heal it. But in order to do that, and in order to prevent a lot of these issues, the answer is really, really boring. You have to go to the dentist every 6 months, you have to brush and floss your teeth at home, and basically do all the things your dentist has been telling you to do your whole life. You see, going to the dentist every 6 months and getting your teeth clean and getting your x-rays done and getting everything looked at isn't a waste of money. It's not something that's gonna make the dentist a ton of money. If every patient did that, then most dentists would probably lose a lot of money. Because if you did that and you took care of your teeth while at home, then you probably would have very little dental problems in the first place. And if you did have any problems, then we can catch it very, very early. That means that if you do need any treatment, it would be very minimal and a whole lot cheaper, and we could probably prevent that treatment in the first place. I mentioned how a cavity that's starting off can actually heal itself. So how can we do that? Well, it's a process called remineralization. So you have to have the right environment. You have to have a good pH in your mouth, and you want to be careful with your diet, and you want to brush and floss your teeth. Now, when you brush, it's ideal to use a remineralizing toothpaste. So something that has fluoride in it would help a lot, because the fluoride can actually remineralize and strengthen our teeth. It actively will put these minerals into our teeth that will make our teeth stronger. Now, if you aren't a fan of fluoride, you can still use a nanohydroxyapatite toothpaste, which essentially does the same thing. It just doesn't make your teeth as strong as fluoride, but it still will remineralize and can replenish the minerals in your teeth. And this is where the flossing is important, because flossing is the only way to clean in between the teeth. If you're leaving all those germs in between the teeth and you're brushing everything else, those germs in between the teeth can still cause cavities in between the teeth. And this is where we look for those cavities on those x-rays. And I did mention the pH in your mouth and your diet, and these two kind of go hand in hand. The thing is, you can brush and floss perfectly and still go to the dentist, but still get cavities. And it has to do with the bacteria in your mouth and acids in your mouth. So the reason a cavity forms is because of a bacteria called Streptococcus mutans. This bacteria lives in your mouth, and it will eat carbohydrates in your diet. So if you eat any carbs, this strep mutans will eat that bacteria, and then it will poop out acids. It'll make your mouth more acidic, and these acids will sit on your teeth and cause holes to form. These holes are, in other words, called cavities. And this is when you need a filling or a crown or root canal, whatever. So the trick is to avoid snacking on these foods that can feed these bacteria. So essentially avoiding snacking on carbs, because if you avoid snacking on carbs, then you're going to help the pH in your mouth or lower the acidity in your mouth. So it's not that I'm telling you to completely avoid sugar. I'm telling you to time your sugar differently. So if you like to have snacks, or if you like to have a dessert in the middle of the day, you want to make sure you're limiting the frequency that you're consuming these things. So let's say you have breakfast, and then you have a snack, and then you have lunch, and then you have a snack, and then you have dinner, and then later on you have dessert. That's like 1, 2, 6 times that you're eating throughout the day. Now, if you combine this with sipping on soda or something else that's acidic throughout the day, then you are going to be destroying your teeth. What you can do instead is limit all those foods and those drinks, except for water, all within those 3 meals. So if you like to have breakfast, lunch, and dinner, have your breakfast plus any other snacks that you want to have all in that one meal. And then wait until lunch to have any other foods that you want to have. And then again, wait until dinner. And then that should be the last meal that you eat. So if you want to have your dessert, go for it, but have it at the same time as your dinner. Have it like right after. And the same goes with your soda or whatever other drink. If you want to have it, that's fine, but have it at the time of your meal. This is important because when you eat something, you get more saliva. Now, your saliva is like a natural bodyguard for your teeth and your gums. It'll dilute the acids, it'll wash away any plaque and bacteria, and it can keep everything clean. But instead, if you're doubling the frequency, if you just keep consuming foods at different times, now you're giving your saliva less time to build up and clean everything away, and you're introducing these sugars over and over into your mouth. You need to give your mouth a break. This is how I mentioned in the beginning of the video that you need to give your mouth a chance to heal, because your mouth can and will heal on its own if you let it. Now, when it comes to prevention, the same thing goes for your gums. There's different stages, for example, with gum disease. So it starts off really mild. The most mild form of gum disease, you've probably heard of it, is called gingivitis. This can actually progress and turn into a different disease called periodontitis. When gingivitis is left alone and it's not fixed, so if you have bleeding gums or if your gums are really inflamed, over time these bacteria can get deeper and deeper in your gums, and then they can start to eat away at the bones that surround your teeth. Over time, your teeth can get looser and looser, and then your teeth might even fall out. This is actually the number one reason people end up in dentures. The good news is that if you have gingivitis, or the most mild form of gum disease, then this is entirely preventable and 100% curable. And a lot of people that have gum disease are just in this first stage. So it's another reason to make sure you're doing your due diligence at home, brushing and flossing, but also going to your dentist to get your checkups and get them properly cleaned. Now, is it true that some dentists might not want you to know this stuff and might just wait to tell you things until things get worse so they can make more money off you? That's possible. But I think most people out there, most dentists want to do good. They want to see good results in their patients, and that's the reason that we entered this field. You know, everybody enters their field to make money. We need money to live, we need money to pay our bills, we need money to survive. But for me, I could not live with myself if I were lying to my patients. And I think most dentists would agree, because we took an oath when we entered this field to do good for our patients. Now, that being said, I did want to talk about the bad aspects of dentistry and some things that some dentists will probably not want to tell you. Sometimes some treatments can get overdone. For example, sometimes people don't always need a crown, sometimes people might not always need a root canal, and sometimes some people might not need to get a deep cleaning. And I know this because I've had patients come to me for second opinions, and I've completely disagreed with whatever initial treatment plan they've been given. For example, I had one patient come to me say that he needs a root canal, he's been told by a dentist, but he came to me for a second opinion. I looked at the tooth, he's having no symptoms, the tooth is totally fine, it just needed a filling. And what do you know, that tooth was still perfectly fine. So I will say that if you are concerned or you just don't really know if you trust your dentist yet, it's always a good idea to get a second opinion. You want to make sure that you're comfortable with whatever decision that you're doing. You want to also make sure that it makes sense. So if your dentist takes an x-ray, shows you what's going on, if they take pictures and kind of show you and really explain to you what's going on, then that's a really good sign. Again, I think most dentists out there mean well, and they're trying to do the best thing for their patients. So I don't want to sit here and tell you to beware and watch out that you might be getting scammed, because I think most people will probably be fine. But trust your gut. If you don't trust your person, no big deal, you can always get a second opinion. And what works for other people might not always work for you. So make sure you like the person that you're going to. So the bottom line is, most dental problems are preventable. So if you do all the right things to prevent them, and you make sure that you're going to a person that you trust, and you're actually going and you're trying to go every 6 months, then you will probably be in great shape. So that being said, thank you guys for watching. I hope you liked the video. If you haven't already, hit the thumbs up button and subscribe to my channel below, and I will see you in the next video. What if one simple change to your bedtime routine could help you sleep better, breathe better, and wake up with a ton of more energy? Millions of people now have started taping their mouth shut to sleep. Now, what the heck is up with that, and is it even safe? If you're a skeptic of this, or if you're thinking about doing it, make sure you stick around for the full video, because I was a skeptic